Have you had enough of chronic lower back or neck pain being a part of your daily life? Are you ready to take care of the problem once and for all? Hi, I'm Dr. Mark Gould. I'm a chiropractic physician and internal healthcare specialist, and I'd like to welcome you to my website for spinal decompression and back pain relief. On this website, I've created a number of opportunities for you to learn more about me and what makes my treatment approach so unique for people like you. People who are suffering needlessly with conditions like lower back and neck pain, pinched nerves, disc herniations, disc degeneration, sciatica, and spinal stenosis. To the left of this video window, you can request 2 free visits at Back to Health Wellness Center. I make this offer because I want to give you the opportunity to see if you qualify for care and to check us out without any financial commitment. You'll also find a short video link by clicking this icon, explaining decompression and how it can help you. Plus, there's some unique interactive software I think you'll find both interesting and instructive. If you're watching this video right now, it's because either you or someone you love is suffering with persistent neck or lower back problems. This may be your first inquiry as to what to do about the pain. Or you might be like many patients I've seen over the years who conclude they have little choice but to live in discomfort, submitting to the ongoing use of medications and injections. Some have reached a point where they believe that surgery was their only option. Even if you had surgery and are continuing to have problems, the gentle, non-surgical treatments I use in my office have helped hundreds of patients just like you. In any case, I want to let you know there's hope and there is a solution to your problems. If you're suffering from low back pain, you're not alone. Consider these statistics. 80 to 90% of adults will suffer with low back pain at some time in their life. It's the leading cause of disability for people under the age of 45, the second leading cause of visits to doctor's offices, and the third leading reason for hospital admissions. Annual costs of back pain here in the U.S. range as high as $75 billion, and studies indicate that 15 to 20% of the population have lower back pain in any given year. That's as many as 62 million cases. I know from my own personal experience how frustrating it could be to live with chronic back pain. It was my own back pain that led me to this profession, and the stories I've heard over the years and the pain I've seen on the faces of my patients have made me keenly aware of your suffering and frustration. This experience and knowledge has made me very passionate about understanding these conditions and delivering treatments that actually bring relief. One of the biggest accepted myths about back pain is that it goes away all by itself, without treatment. Most medical doctors believe the claim that 90% of all episodes of low back pain will resolve within 1 month. However, a study published by the British Medical Journal in May of 1998 showed they followed the progress of back pain patients for 12 months after their initial medical consultation. It found that only 1 out of 4 patients saw their pain resolved. Sadly, this means that 3 out of 4 continue to suffer. So how am I different than all the other doctors you've seen, and what therapies do I offer that are different than everything else you've tried for your condition? Well, briefly, I treat you both metabolically and neurologically. I'm among a select group of doctors across the country that are sharing diagnostic and healing methods that are helping thousands of pain sufferers just like you. One of my mentors, Dr. Michael Johnson, is the author of this best-selling book, What to Do When the Medications Don't Work. This book and Dr. Johnson's ongoing work with doctors like me has literally improved the lives of thousands of pain sufferers, and I'm confident it can help improve yours. I've been studying back pain for years with top physicians around the country, traveling across the nation to learn what's working. I've done this so I can bring these breakthrough treatments and advanced technologies to you to relieve your pain. Join me in a quick tour of my office that will help you understand what makes my clinic and approach different and more effective with conditions like yours. This is our decompression therapy table. Let me tell you a little bit about the equipment and the treatment. During the entire treatment, you're very comfortable, and many of my patients just fall asleep. The table is a state-of-the-art in decompression. It was designed by Dr. J. Kennedy, who used and analyzed every other decompression table ever built before designing this one. It's not only very comfortable, but it's the most clinically effective table I've ever used. It's also the only one in use today that is solidly based on biomechanical and clinical research and not based on marketing hype. I've seen fancy bells and whistles on other tables that are added solely to give a high-tech impression, but there are basic physical principles and functions that must be built into the table in order for it to be effective. It must apply a decompressive force on the spine and create an imbibing or gentle motion of the disc and spine, and the Kennedy table excels in performing these functions. Of course, the most important part of the treatment is not the table, it's me. It's my knowledge and training that makes the difference. Here at our clinic, I can assure you that you're not only being treated on the best equipment available, but you're being treated by a doctor who is thoroughly trained in the diagnosis and treatment of your condition. Let's move on to some rehab equipment I'd like to show you. This is the ATM2, which stands for Active Treatment Movement. It's been a fantastic addition to the clinic, and it's been helping to resolve many neck and lower back pain problems. It may look a bit intimidating, but being treated on it is really very comfortable. I've seen patients who've had years of back pain that didn't respond to anything become and stay pain-free just after a few visits and treatment on the ATM2. Another nice thing about this treatment is that the patient not only experiences lasting pain relief, but there's also increased range of motion. As a clinician, seeing both elimination of pain and restoration of function is what makes this device really unique. Let's move on to our deep tissue laser therapy unit. Our LightCure deep tissue laser therapy unit is amazing new technology. We are the first clinic in Illinois to offer this breakthrough treatment and are still one of only a handful of clinics that actually offer it. It reduces inflammation, eliminates pain, and promotes faster healing, often at the very first visit. It's referred to as a Class 4 laser. It's the latest therapeutic laser to be fully approved by the FDA. Class 4 lasers are 1,500 times more powerful than the Class 3 cold lasers used by most healthcare providers today. Its effectiveness lies in its ability to penetrate much deeper below the skin to a depth of 3 times that of the Class 3 cousins. It repairs tissue faster with absolutely no side effects or risk. Deep tissue lasers are being used by a number of professional sports teams to reduce pain and promote faster healing of their million-dollar athletes. Laser therapy is a natural addition to decompression therapy because it can reduce inflammation of the tissue, relieve pain, and promote healing in avascular structures like the spinal disc. We use it in many cases of lower back pain and neck pain, joint pain, arthritis, and the results our patients are receiving are nothing short of amazing. Treatment times are very short, and relief happening in as little as a few days to a few weeks, sometimes right after the first visit. As we age, recover from trauma or surgery, or simply need relief from everyday aches and pains, this advanced technology offers my patients a drug-free, surgery-free, pain-free, effective treatment alternative. Now you've seen that I've equipped our clinic with cutting-edge approaches for treating your back or neck condition. The best equipment and approaches are what you deserve, but I'd also like you to know that I fully understand that every case is different. That's why our treatment philosophy is always to treat the person, not the diagnosis. This is also why, as a clinician, I look at each case from a functional neurology standpoint and must always evaluate your whole body and all the important metabolic factors if we're going to have success in restoring your good health. Your therapy plan will be tailored to fit you and not just your diagnosis, because focusing on one area alone can lead to the wrong treatment approach. This is why we're successful when so often others fail. We treat you both metabolically and neurologically. Now, I know you've probably been through a lot, and at some point you may have just wanted to give up, but I want you to ask yourself the following questions. How has your condition affected your relationships, your finances, your family, your lifestyle? What does it cost you in time, money, comfort, happiness, sleep? Where do you picture yourself in the next few years if this problem isn't taken care of soon? And what would it be worth to you if we can improve or eliminate your condition? If you're tired of dealing with this problem and are worried about it getting worse, order my free report and learn more about how we can help. Just fill out the form on the left side of this video screen. To schedule 2 free visits with us, include your phone number so our staff can contact you, or call us at 847-550-1818 and we'll get you set up for your first appointment.